May mga usaping pangkalusugan na dapat talakayin ng tama, malinaw, at may malasakit. Nandito tayo para gawin iyon. POGScast, Let's Talk Pinay.
Ito ang POGScast, hatid sa inyo ng Philippine Obstetrical and Gynecological Society.
Ikaw ba'y nakakaranas ng oily skin, acne, or pagdami ng buhok sa katawan? Ito nga ba'y parte lang ng pagdadalaga o senyales na ba ito ng hormonal imbalance? Ano nga ba ang PCOS or PMOS? Ating talakayin.
Magandang araw. Ako si Dr. Angel Tan Espiritu, ang POGScaster sa episode na to. Ngayon, tatalakayin natin ang tinatawag na PCOS or sa bagong termino, PMOS, na nagdudulot ng hormonal imbalance, infertility at maraming panuuba. Ngayon, kasama natin ang mga eksperto mula sa TSRM, si Dr. Aying Manalo at si Dr. Ina Erabon para gabayan tayo. Maraming salamat po sa inyong pagdalo sa ating panayari. Thank you, Mama. Alam ko, very busy kayo. So, let's begin. Ano ba itong tinatawag na PCOS or Polycystic Ovary Syndrome?
Sige, PCOS is really the most common cause of hormonal imbalance ng mga babae, no? So, pag sinabi hormonal imbalance, they would present with irregular periods, no? To the point na minsan hindi nga nagre-regla the whole year. But usually, nadidelay talaga ang menstruation kasi ang menstruation dapat 1 buwan dumadate, every 20 days. So, ito mga pa ito, halos hindi din natin nagregla o laging nadidelay. Tapos, bukod doon, nag-permit other sintomas. So, meron silang signs of androgen excess. Androgen is the male hormone, so it will manifest with hairiness. So, bagbon sila, tapos may oiliness of the skin, tapos lagi silang pinipimples or tinitigyawat. So, bukod doon, pag ginawan mo ng ultrasound dito, mga kababaihan to, makikita mo, meron sila pinatawag dati polycystic ovaries. Sa ibig sabihin, marami sila pang maliit na cyst, mga less than 1 centimeter, na parang pansungka tuloy yung ovaries, no? So, yun na kinatawag natin polycystic ovary.
So, isa ko lang definition. Sa polycystic ovary syndrome, kailangan mag-fulfill natin yung criteria. One of the key criteria, tawag natin sa criteria na yan ay Rotterdam criteria. So, para masabi na merong PCOS, dapat 2 out of the 3 mag-fulfill yung pasyente. Hindi pwedeng ultrasound lang, automatic. Meron ka ng PCOS o porket irregular lenses, automatic may PCOS ka. So, actually, pwede ka nang ma-label na may PCOS na wala kang ultrasound. Basta ma-fulfill mo na yung first 2 criteria. Yung mga criteria, nabanggit na po nito para manalo yung irregular menses, katumbas lang hindi pag-ovulate na pag-ovulate or anovulation. Pangalawa, yung signs ng hyperandrogenism. So, sabi dito para manalo kanila, like excess hair, yung acne, yung tagyawat. Skolapto, yung udbas ng tayo dito, polycystic ovaries.
So, actually, very timely itong usapan natin kasi lumabas sa mga findings ngayon na PMOS na yung tawag. Can you discuss a bit about this new terminology?
So, PMOS actually stands for Polyendocrine Metabolic Ovarian Syndrome. Kasi matilala naman nating alam na ang PCOS hindi lang ovarian, no? So, talagang may metabolic component. In fact, the most common cause of PCOS, aside from genetics, is insulin resistance. Anong bang ibig sabihin ng insulin resistance? Yung pag kumakain tayo, yung pagkain natin gets converted to glucose, and glucose to energy para makadalaw tayo, makagawa tayo ng activities natin. And you need insulin to convert that glucose to energy. Mga pasyenteng may PCOS, hindi nila nagagamit yung insulin. Kaya pinatawag natin insulin resistance sila. So, with insulin resistance, tumataas yung male hormone. Kaya pag tumataas ang male hormone, ayan, nakikita na nga yung androgen excess manifestation. So, nagpipimples sila, tapos hindi irregular periods sila. So, yun, they have anovulatory cycles. Pag anovulatory cycles, hindi nga sila nangingiklop, so hindi sila mandalan silang mangkundes. So, ito na yung kinatawag natin insulin resistance. And it leads to diabetes. So, kung hindi mo magamit yung glucose mo, it gets stored in your liver. So, yun, nagiging fatty liver, it also leads to diabetes, no? Yun. Kaya yung mga patients ka natin with PCOS, kadalasan sa pamilya, mayroon yan diabetes. In fact, sa practice, in my 3 decades of practice, yung mga patients may diabetes sa family, PCOS yan, until proven otherwise.
So, Engel, nagkabula. Kasi yung term na PCOS masyadong nakafocus sa cyst. Pero po, kaya parang yung term na PCOS is kind of like a misnomer tawag ni Gadiwa. Kasi parang misleading, very inaccurate. Teka, kailangan talaga, napalitan yung word na cystic. Kasi parang natatakot yung pasyente, Dok, may cyst ako. Kailangan ba ako operasa? Parang factually,
And in fact, yung ibang mga doktor, akala operahan talaga damas sila. Pero well, in fact, hindi nila kailangan na operasyon.
paano matabi? It no confusion about patients o policy makers din, no? Hindi nila alam, cyst ba yan? Operahan ka pa. Kailangan makatampondohan.
So kayo siguro na-shift na from being a
Purely ovarian.
or anatomic disease to ang truly metabolic disease or endometriosis. So ano pa yung mga nabanggit na nga natin endocrine. So dahil po nakahikokos siya ng diabetes, it's really a lifestyle-related disease. So what are the complications that we expect to see mga lifelong?
So yun, because of the insulin resistance, these patients are more prone to diabetes. In fact, a lot of them become diabetic during pregnancy. And during pregnancy, you have all sorts of these complications. So, madaling makunan. So, 3 to 4 times higher sila na nakukunan. Also, they're more at risk of preterm deliveries, of developing preeclampsia, so hypertension during pregnancy. Tapos, pati mga baby sila, kadalasan merong growth restriction. And so, mas mataas sila yung risk of having cesarean section during pregnancy. So, it's really a complicated pregnancy. So, high risk yung pregnancy. Long term, so aside from diabetes and complicated pregnancies would be hypertension, heart disease, so they're more prone to die, less cardiovascular disease, and yung mga hormone-related cancers, that uterine cancer, kasi nga hindi nangingitlog, umakapal yung lining ng uterus na sila nagre-regla, more prone to uterine cancer, and even breast cancer, which is also hormone-related. Kaya dapat talaga, the moment na na-detect na may PCOS ang babae, dapat lifelong silang inaalagaan.
Tapos yung pinaka-popon na, syempre, consequence in fertility. Iwa buntis, o hirap ko buntis. Yan nga saan ovulation, hindi sila madalas nag-ovulate.
So they need to consult early.
Yes. So ito yung gusto nating malaman sa mga kababaihan at saka sa lahat ng mga nakikinig sa atin na the moment na na-diagnose ka ng PCOS, huwag ka na mag-delay sa pagpapakasal and having children. Kasi iba sasabihin, alam ko na 10 years ago na PCOS. Tapos hindi naman sila nagpapatingin. Tapos meron kasal sila 5 years, hindi sila nagpapatingin sa doktor. So the moment that you decide na you're going to get married, dapat within 6 months, actually, nagbubuntis ka na Pag hindi ka pa nagbubuntis, ang tatingin ka na. Kasi alam mo, ang problema hindi ka nandinitong. So you are really prone to infertility.
Kaya very important talaga yung awareness no? Ng sintomas na, okay, baka may PCOS nga ako, kailangan ko magpatingin na hindi dapat tino-normalize. Hindi, irregular menstruation. So, nagdadalaga. Ito yung acne ko. Mawawala din yan. Hindi. Kailangan talaga magpatingin ka agad. Dapat aware tayo ka agad. Tapos, ma-diagnose ka agad and you will be given prompt treatment.
Tsaka nga pala yung mga manifestations would vary during the life stages. So, yung mga teenage years, kasi in the early teenage years, hindi natin pwede siya malabel silang polycystic ovary. So, they're at risk of polycystic ovary syndrome. Pero yung latter teenage years, mga 19, 20, yan. So, dapat talaga, nawawala na dapat ang pimples, dapat regular na ang period na. So, kung meron pa rin, chances are may polycystic ovary syndrome sila. So, these patients will come to us, dala ng mga mami nila, sabihin, doktora, laging may pimples yung anak ko, hindi makorek. Kaya nga yung dermatologist nila refer sa inyo para makorek din itong pimples niya. Now, pagka naman nag-asawa, ang problema naman, infertility. Tapos, menstrual irregularity, mga ganyan. Pag hindi mas madanda na, ayan na, mambo pa mag-menopause, kayo na nga yung risk of diabetes, heart disease, and so on, hyperplasia.
Yes.
And even after the menopause, there are risk of cancer. So, dapat, pinagantayan natin itong mga babae.
So, Toki, nabanggit mo yung sa Rotterdam criteria. No? So, paano nga ba natin na-diagnose PCOS? Aside from the Rotterdam?
There's no single blood test, hindi pwedeng ultrasound lang ang pagpasinan ng diagnosis ng PCOS. Katulad yan na nabanggit ko nina, dapat kilipnan. So, meron tayong criteria na sinusunod. Dapat kaya nabanggit ko kanina yung Rotterdam criteria, 2 out of the 3 criteria from the Rotterdam. Plus, kailangan din natin exclude yung mga disorders na may kaparehong symptoms ng PCOS, di ba po, to Asia. So, yun nga, nabanggit ko na dapat, yun nga, yung tatlong criteria, yung yung irregular menses, pangalawa yung hyperandrogenism, pangatlo yung kudrasal na kaya din na polycystic ovaries. 2 out of the 3, pero kang PCOS. Sabi ko nga, hindi kailangan na ultrasound finding lang. Naku, wag tayo magkakamali na ipa-acid doon. Marami kasi tayo mga pasyente, bilabase. Dahil kung sa polycystic ovaries, pa silang nakita nilang ultrasound finding. So, hindi ko pwedeng ganon.
Sala, hindi po pwede na porque nawala na yung polycystic ovaries, wala direct PCOS. So remember, PCOS is a lifelong disease. So there will be times na hindi mo makikita yan, no? Pag nagre-regular na yung periods mo, pinibigyan ka kasi ng fertility drug, syempre hindi mo makikita masyado yung polycystic ovaries. Pag tumanda ka na after the menopause, less na yung manifestations na yan. But you still have PCOS. So if you are diagnosed, you have to believe that you have it for life.
Yeah, we're not cure. And it's importante that PCOS is a lifelong disease. Hindi po yan nakawala. Pwede rin tayo bigyan ng mga gamot. Kasi ko pa yung symptoms. Diba po? Pero hindi ko siya nawawala.
Wala yung mga you're free or I'm cured of
Yes. Tatibalik sabihin niya. Yes, so po kayo maniwala doon.
Kasi minsan, di ba, may mga patients, Dok, nagagamot na ako, pat PCOS pa rin sa ultrasound. Or sasabihin ng doktor, wala ka ng PCOS, malinis na yung ultrasound mo. Or, it's not
Doktora, ang malit yung PCOS ko.
hindi naman nawala.
Hindi na wala. Disrespect.
Meron po ba kayong mga specific blood test na pinapagawa for PCOS patients?
Meron. So, kung gusto nating ma-document yung androgenic cells, so maybe kasi yung babae, walang ka-hair sa mukha niya. Ano? So, there are some women who are not so hairy. In fact, yung Chinese women are the least hairy people. In contrast naman, yung mga Middle Eastern women, mga Spanish, Italian, ay mga mga mestiza sa atin, yung mga balbon yung mga babae niyan. Pero yung mga Chinese, usually not very hairy. Yung mga Filipinos, maybe somewhere in between. Mga 4 to 6 ang grading natin sa sa hairy ng skin. So you have to check yung testosterone level. So ito yung androgen. So they can take the testosterone level. And then you can also get the adrenal androgen. So yung the DHEAS, dehydroepiandrosterone. And ideally, androstenedione tayo. Kaya wala tayo niya sa Pilipinas. So we ask for the 17-hydroxyprogesterone. Yun. So kung pwedeng wala signs of androgen excess, pimples, clear yung skin nila, wala silang oiliness, wala silang hairness, but you can ask for that. That's already androgenism, hyperandrogenism. And then, if you want, you can also check the gonadotropins FSH and LH kasi mas mataas ang LH ng mga babaeng to. These are gonadotropins, these are hormones coming from the brain. So, mas mataas yung LH. Okay? Then, of course, the ultrasound finding of the polycystic issue ovaries. So, those are the basic tests. But you also would want to check for mga dyslipidemia. Check for the sugars. So, check the cholesterol, total cholesterol, the good cholesterol, HDL, the bad cholesterol, LDL, the triglycerides. You check for even liver functions kasi they might have fatty liver. And the sugar. So, yun ang kung pinaka-basic ang gusto mo, at least the sugars, the fasting blood sugar, hemoglobin A1C, pero mas maganda yung 75 gram oral glucose tolerance test kasi 3 values ang titingnan natin doon.
Importante din kasi, Ma'am Doc Angel, di ba, we have to exclude other disorders na may kaparekong sintomas sa PCOS. That's why we also have to exclude thyroid disorders.
Correct.
Adrenal disorders, even hyperprolactin.
But you also have to know that some patients, 10% of PCOS patients have had rare anemia. And some do have some thyroid dysfunctions. Pero kung talagang obviously thyroid disease, hindi naman PCOS, don't label it as PCOS. Remember, pag ang pasyente, chronically hindi nangingitlog, makikita mo yung polycystic ovaries. Pag nakapil sa babae, hindi siya nangingitlog, makikita mo na ovaries polycystic. Pero it doesn't mean she has the syndrome. Okay, so you as mentioned by Dr. Ina, na 2 out of 3 you always have to have the 2 out of 3 criteria that are fulfilled.
Yes. So, ngayon na-diagnose na natin, no? Paano po itong ginagamot?
So, management actually depends on the symptom of the patient. So, at the start, yung mga younger patients, kung ang problem lang nila is yung pimples, then they can put them on the pill. No? So, to regulate the period, the estrogen component of the pill actually increases the sex hormone binding globulin. Ito yung part of our hormonal system which lowers the male hormone. So, bababa yung androgen levels. So, pag-clear up ang skin. So, at the same time, kire-regulate yung menstruation. So, if your complaint is pimples, irregular period, pills should take care of it. So, regulating the period and getting rid of the pimples. Pag gusto naman magbuntis, pamibigay tayo ng fertility drugs. So talaga kailangan ma-manage siya kailang OBGYN, and more especially by the specialist na reproductive medicine doctor who will give you fertility drugs. Kasi nga at risk din ito mga pasyente to ng hyper-response, either poor response to fertility drugs or even hyper-response to fertility drugs. And so we should know how to manage this. And then, of course, we control the sugars. Pero number one in the management is lifestyle management. So, these patients...
diet.
So, 60%
Diet exercise.
Kasi 60% of our patients are obese. So 40% of patients with PCOS are lean PCOS patients. So they're insulin resistant pero payat sila. Pero they still have PCOS. So the 60%, ang sinasabi natin, mag-lose lang sila ng 5 to 10% of their weight, actually improves their insulin resistance. It makes them insulin sensitive. Nagiging regular ang dahlia nila. Yung iba, spontaneously nag-ovulate, mas madali silang bubuntis, mas mababa ang chance nilang mag-miscarry during pregnancy. They also have less complications during pregnancy. So the weight loss really does a lot of things for these patients. Not the lifetime effect of that one. Kasi nga, kung regular na ang period mo, less ang risk mo of cancer, of uterine cancer, of breast cancer. And so, how do you achieve the weight loss, Ina?
Well, diet and exercise is always the staple here. Tapos, hindi kailangang payata, Doc Angel. Di ba? Nga ba? 5 to 10% na kailangan. Doc Angel, what we want to emphasize sa mga pasyente natin is that ang treatment na PCOS ay hindi pare-pareho sa lahat ng mga babae. Ang treatment na PCOS, determine kung ano concern mo, kung ano yung sintomas mo. Halimbawa, ang problema mo ba ay irregular menses or ang problema mo ba ay infertility. So, kada problema sa PCOS, yun ang ibibigay namin specific treatment. Hindi porket yung kapitbahay mo may PCOS, yun ang binibigay. Hindi porket yun ang binibigay sa kanya, yun din ang dapat ibigay sa iyo.
No. Pero yun na, weight loss can actually take care of all the
Correct. Dapat yun ang first 9. Dapat first 9.
because weight loss can make these patients insulin sensitive. And yung insulin sensitive, mas maganda ang effect sa hormones mo, mas regular ang period, mas nag-ovulate. And now, there's another component to polycystic ovary syndrome, and that's mental status. No? So, our patients are really more prone to depression and anxiety. Probably because a lot of them have weight problems, and, so yung self-image, no? But also because of the androgen excess. So they worry about the pimples, they worry about their hairiness. And in fact, a lot of these young individuals, in their early 20s, they're very clammed up. Yung iba nga dadating sa'yo, mga antidepressants. Yun. So, which can of course affect also their menstruation or, the regularity of their periods. So, kailangan talaga na i-address sila ito. And so, sometimes, we really have, of course, it's part of our counseling, no? Na they do the weight loss, they do the diet and exercise. It also makes them feel better, no? When you exercise, you produce your own endorphins. And so, that makes you, those are the happy hormones. But aside from that, sometimes we have to also get the psychiatrist or psychologist to come into the picture in order to improve the mood of these individuals. Yeah, so they can feel better about themselves. And we also monitor their weight loss, no? So there's so many ways by which we can do the weight loss thing. Meron na nga tayong mga peptides, GLPs, which can be given to these patients if they're not really desirous of pregnancy at this point, no? If they are desirous of pregnancy, then maybe we can give these for about 2-3 months. But the main thing here is diet and exercise.
Can we talk a bit about like metformin and myo-inositol and how it plays in the management?
Well, kasi di ba, Dog-Ancient, ang settled pathophysiology kasi is insulin resistance, and that's why a lot of women with PCOS are given metformin. Lalo na women who are undergoing fertility treatment, yan talagang madalas bigyan ng
Bakit nga ba? Kasi ang metformin is an insulin sensitizing drug. Tanong din ang inositol. Both are insulin sensitizing drugs. So if they make you insulin sensitized, then you do better in terms of regular periods, ovulation, yan.
Marami kasing mga GI symptoms or effects ang metformin, kaya hindi takat ng babae nakaka-tolerate parang metformin. That's why in comes inositol, which is a milder form. It's actually considered a food supplement. Alright. So it can do well for these patients. Mas kayang i-tolerate. Mas less yung side effects and therefore mas kayang i-take yung mga patients.
So for the sake of our audience, sino yung binibigyan nyo ng minoxidil or metoclopramide or both or fertility pills or
Ako,
usually ang dami ng
personally, lahat yun niya, parang metformin. Personally. Kasi talaga, believe na believe ako sa kanya. I personally take metformin because I know I have PCOS as well. And my 2 daughters have polycystic ovary syndrome. So it really makes you insulin sensitive. It adds in, it also brings about weight loss for a lot of these women. Not as quick as the peptides, pero meron ka pa rin weight loss. It also lowers the risk of miscarriages, lowers the risk of diabetes, even during pregnancy. And also, like when we're giving fertility drugs, especially yung mga IVF patients, it lowers the risk of hyperstimulation. So talaga yung mga complications. Now, inositol I give to those patients who cannot tolerate. But if they want both, why not? If they can afford it, then taking both would be actually adding on to the benefit or the other. So they're not contradictory.
So yun, yung mga pasyenteng hindi talaga makatolerate, then bigay pelosicos. So thanks ka, di ka to our clinics.
Inositol na sila.
Nakilipurting ng inositol. Oh yes, you know why Doc Angel? Because these kitang TikTok.
Yeah.
Nandun na yung inositol sa TikTok. That's why a lot of them.
Because it's covered in the food supplement ng gaya. Tsaka wala akong side effects.
may iba tayo, no? Meron kasi mga myths about PCOS and gusto ko sanang maliwanagan tayo, no? So, I think medyo nabanggit na rin natin yung iba kanina pero dadaanan ko lang sana. So, yun. Kailangan bang makita na may cyst sa ultrasound para masabing PCOS? Or kapag normal bang ultrasound, actually, nabanggit mo na kayo, but I just like to reiterate for the office. So, pag normal bang ultrasound, it's been gumaling yung PCOS niya or wala siyang PCOS.
Tulad ng nabatik ko kanina, hindi kailangan ng ultrasound, magkaroon ka lang ng sintomas na irregular menses at yung hyperandrogenism, then pwede ka gan malabel as having PCOS. Yung ultrasound, of course, is still part of the criteria, pero hindi siya mahalaga. At hindi porket sinasabi na wala kang polycystic ovaries, ibig sabihin wala kang PCOS. Pwede kasing normal yung finding sa ultrasound, pero meron kang PCOS. Okay, so
I think the history is very important. Kasi some patients come to us, Doc, nobody told me I had PCOS. Pero kung sasabihin ka lang, and then you look in the history, dati di ba irregular ang period mo? Oo, tapos tawag dito, mo, may hair ka. Yung iba, walang masyadong hair, pero pag tinignan mo yung breast, may hair sa nipple, no? May hair sa chest. Also, these are androgen excess manifestations kasi ang hair sa babae should be peripheral sa arms and legs, pwede pa. Pero if you're seeing hair in the center portion, merong bigote, may hair dito sa baba, may hair sa sideburns, may hair sa nipples, dito, ayun, those are hairiness. Also, those are signs of androgen excess. And sometimes people miss those. So that's important talaga that you do a proper history taking and proper physical examination of your patients. Yeah.
Minsan na papasok pa lang yung pasyente.
Pagpasok pa lang, alam mo, dada yung siya, PCOS.
wala man na siyang skin manifestations.
Tsaka iba, di ba, yung tinatawag natin acanthosis nigricans. So, the darkening of the neck, tapos yung armpits, tapos yung sa singit. Yeah, that's acanthosis nigricans. Pag nakita mo yan, alam mo, insulin resistant yung tako. Okay? And at risk of diabetes.
So, yung iba, yung isang myth pa nga, diba, isip na, ay, pag may PCOS ka, hindi ka na magbuntis.
Hindi man totoo yan. Mahirap magbuntis, pero kaya talaga maiahas. Kaya kailangan lang tulungan. Kaya, do not delay. Yun ang sinasabi natin. Iba, tagal-tagal lang nila alam PCOS, pero hindi sila, they take a long time before they decide to get married. Tapos, bago ka magpatingin, another 2 or 3 years. So, don't do that. You know that they're at risk talagang patita na maaga.
Doon tayo papasok, may nang role natin muminagid fertility specialist to guide them sa treatment ng PCOS.
Kasi minsan, sibit, dahil lang ito sa weight gain. Suka. It's another myth, no? Less.
Well, kasi yung weight gain makes it more obvious, no?
Yes.
So, nagiging mas grabe nagkaka-pimples, nagiging mas irregular yung period. It's been there. Kasi yan you're born with that So, there's a genetic component there, di ba? Tino mo, pag may PCOS ka, yung nanay mo, usually may PCOS, yung kapatid mo, yung mga cousins mo, usually may PCOS. Meron ka rin ang lalaki who will manifest with the PCOS, the male version. So, kung madali siyang kalbuhin, maaga siyang kinakalbo. No? So, taba, hindi siya, ganyan. So, may diabetes. So, talagang, related yan. Ang problema, yung iba, they have the manifestations ng tumaba na lang sila. So sila tumaba, mas doon na naging obvious. Pero they've had it ever since. Hindi lang napipick up.
Obesity kasi worsens the insulin resistance. Kaya pagka papansin nila, pagka nagkigain sila ng weight, ayan, tumitigi yung mens nila, nag-worsen yung acne nila.
Pero meron ba maditindi rin yung mga lean PCOS?
Basta hirap sa
Kasi ko na nga mapapapayat eh. Mas
mahirap sila gamutin. Tsaka usually at the last, isa pang ang tawag dito, requirement for diagnosis now is anti-Müllerian hormone. So pag mataas yan, normal AMH, anti-Müllerian hormone tells us kung how much ovarian reserve, kung ilan ang itlog meron ng isang babae. No? Siyempre yan, pakunti pag tumatanda tayo. Ang normal is 1.3 to 4 nanograms per mil. Ang mga PCOS patients, 4.5, 10, 20, I've seen 40, 50 na nanograms per mil. So, pag mataas na mataas ang AMH, alam mong PCOS yan. And usually, it's the lean PCOS patients na mataas ang AMH. So, pag mataas ang AMH, mahirap mag-respond sa fertility drugs sa oral. And usually yan, mag-respond na sa mga injectables. Pag binigyan mo naman ng injectables, mas prone sila sa hyperstimulation. Diba, pag naninilog, gusto mo isa, dalawa lang ang mangitlog, diba? Kasi you don't wanna have triplets, quadruplets, quintuplets, diba? Pero itong mga patients na to, pwede silang quadruplets at any one time with just the oral medications or just a little bit of the gonadotropin. So, mas mahirap silang pabuntisin.
Ang mahirap na pabutisin, mahirap pa i-maintain yung pregnancy. Pag hindi na puran, pwede na mag-diabetes. So, medyo challenging talaga. And then, after nila manganak, we also have to emphasize na hindi natatapos yung gamutan.
Yes, so, kasi lifelong nga eh. Dahil manganak ka na, matapos kang manganak, kailangan ibalik ko yun.
Pero ang beauty niyan, yung iba pag nanganak, mas nag-regulate yung menstruation nila.
Yes.
Tapos, kasi nga, actually, naalagaan mo na rin sila as you may abuse the way. So, kumbawa, nagka-gestational diabetes sila, mas alam na nila yung tamang pagkain na dapat nila kinakain. So, mas careful na sila para hindi sila bumalik sa diabetes.
For na-maintain sentiment for me. Yeah, yun, mas maganda na yung blood sugar control.
Actually, mayroon akong patients na ayaw magamot. Tapos they follow a very strict diet. Tapos healthy diet.
Worked, yes.
It actually works better. It's just it's more difficult to do.
Sometimes na talk, Angel, yung mga infertile patients, hindi mo lang mag-lose ka muna ng weight. Hindi ka back to your pregnant. So, take it sa pregnant.
Ang problema, minsan nila babalik. Mahirap mo. Take it from me. Mahirap magpapalit.
Mahirap naman talaga.
Pero yung ang isang nakakalungkot lang, yung risk of hyperplasia and endometrial cancer. I've seen mga infertility patients who come to us as hyperplastic.
Correct. Pero kaya pa rin, hyperplasia or early stage cancer, pwede mo pang reverse yun. Kaya dapat na magpatingin ng maaga.
So, like may 28-year-old ako, cancer na agad. So, ang maganda dito, pwedeng mag-abot. Diba? Hindi po lahat tatanggalin na gandang mata sa tayo.
Meron akong 22-year-old.
Ako nga ako may teenager. Cancer, yes.
Kaya talagang dapat pick up na maaga. Oo, don't just say, ay nako kasi immature pa yung yung reproductive axis.
Pwede naman i-pills talaga. Ito, I'd like to, siguro last myth natin to, no? And I think this is what that really bothers me, Kasi a lot of patients, pag nabigyan ng doctor nila ng gamot for 6 months, hindi na sila babalik kasi akala nila okay na eh. So, hindi na-explain sa kanila and they think, mawawala naman tong PCOS mo pag naggamot ka for 6 months ng pills. Can you comment on that?
Pet peeve ko yan. Kasi sabi nila, 6 months of pills, okay ka na.
Tapos ako, ang mas pet peeve ko, bibigyan ng pills pero gusto magka-baby.
Ay, nako, isa sa
3 years ng infertile, bibigyan ko ng pills. You regulate the period for 3 to 6 months. You don't do that. You give fertility drug.
Kaya sa dapat importante, treatment, kasi depende kung ano ba yung concern ng pasyente. Hindi dapat yan across sa lahat ng pasyente, pare-pareho na feeling.
Tsaka yun na, pag na-diagnose ng PCOS, okay, tell them, magpipills ka. Pero dapat, every 6 months, papatingin ka kasi after checking for diabetes. So, every 6 months, at least, we check for 75-gram OGTT, oral glucose tolerance test, to find out if they're developing diabetes. You want to pick it up early so you prevent the long-term complications.
Yeah, ang gusto ko lang sabihin, like, sa paratingin sa mga pasyente, no? Yung 6-month period, hindi yan yung treatment mo. It's the time we allow the treatment to work, but you have to come back for assessment.
And also, is there problems in between? They can always come back. Like, say, they can't drink better. Nasusuka sila. Usually, sila pwede tumigil. Mabay, you can give up alternatives. But if they can't tolerate the pill, di ba? May mga side effects yung manituong to.
True, like, tsaka pag natapos na yung 6 months, hindi yun nag-e-endo, no? Babalik ka, kasi tutuloy pa natin yung gamot. Kailangan natin ma-check na okay sa'yo.
Pero nakakatawa din yung mga pasyente na, yun na nga, maagang sila na-diagnose. Tapos, ito na, mag-aasawa na sila. Talagang guided sila, papatingin na sila, although may school na magka-baby, tapos sila nga, napabuntis mo na sila ng anak. Talagang, ito yung mga patients na, ano naman, nakakatawa, nakakataba ng puso na nakikinig talaga sa'yo. At nakikinig nila, o naintindihan nila yung kakakilang gawin.
Angel, dagdag ko lang na iparik kayo sa 6 months. Kasi, alam niyo, sabihin ng pasyente, ito, kasi yun yung sinabi ng POGScast. Di ba po, di naman dahil pagkasara ng pasyente, kasi ama na nila, kasi sigalis sa kanila. Kumbaga, dahil pala sa maling counseling, healthcare provider.
I see that a lot actually. Yung mga 10 years ago pa tayo doon sa PCOS. Tapos walang counseling na ginagawa. Kaya also, for us OBGYNs, that's very important. Once you make a diagnosis of PCOS, make sure na anakaan niyo yung pasyente. Don't just, let them be and pagka wala nang nararamdaman, hindi niyo na i-follow up. These patients have to really become a self.
I think let's also take this opportunity, mamali, and our other colleagues na mauhalik. Palawa, within 6 months, kahirapan na po tayo sa treatment natin ng PCOS patients with infertility. Maaari po ka nang i-refer po natin sa reproductive endocrinologist para po makatulong po kami sa pasyente. No? Sorry. Kasi baka mamaya, isagad ang treatment ng infertility sa mga pasyente na hindi naman pala epektibo para sa kadya.
Kaya saka speaking of yung barabanggit mo, ang tagal i-regulate yung menses bago i-work up. The workup itself helps regulate the menses because you're helping them ovulate, di ba? So, yun yung gusto nating iklaro. Maraming oras ang nasasayang. So, also yung iba naman, sasabihin na, Dok, nag-pills ako, hindi naman nag-work, so tinigil ko na. Hindi, ako gusto ko paalo.
Always another thing, diba? Yung taking nila na pag tinigil nila, magiging normal yes. Nila. So, for some, yes, merong nagre-regular yung period pag tinigil yung pills. Then, the majority, balik kasi naando pa rin yung insulin resistance. Kaya nga, the weight loss helps. So, let's say, if they went on the weight loss process, they maintain their weight loss, pwede talagang mag-regulate siya. Tapos, pwede kang mag-ovulate on your own and get pregnant on your own. But the majority will still have irregular periods kasi it's a lifetime disease.
Saka sabi na hindi nag-work, kasi sabi ko, no, tinitake mo, nag-work. Opo, tinigil mo Kaya hindi nag-work, no? So, it's sort of a maintenance thing. For some, unfortunately, for majority, it's gonna be a maintenance thing.
Kung nakakatulong ang usapan na ito, maaring mag-like, share, and subscribe sa POGScast. Baka ito na ang impormasyong kailangan ninyo o ng mga mahal nyo.
Masarap po yung naging talakayan natin, no? But I think all good things have to come to an end. Before we end this talk, may I ask final words from Doc Ina? I need some Doc Ina. You go first.
I think as a healthcare provider, isa sa mga pinaka-effort nating mensahe na gusto kong ipanating sa ating mga kababaihan is, alam niyo, ang PCOS, hindi lang to simpleng problema sa regla. Hindi lang to simpleng problema sa hirap pagkukumpis. Ang PCOS ay isang disorder na naapektuhan ang ating buong katawan. So, dapat talaga importante ang awareness, yung maagang diagnosis, at prompt treatment. No? Sa PCOS, hindi lang dapat natin tina-target yung kung ano yung sintomas nyo ngayon. Kailangan importante protektahan ang kabuoang kalusugan nating ang ating mga pasyente.
Just very little to add to that one. Pag diagnose ka na PCOS, alam mo kung gusto mo ka-baby, pwede ka na ma-up. So, 6 months lang ang liway natin. Kasi infertility defined as 1 year of inability to get pregnant with unprotected intercourse. So, meron kang 1 year liway. Pero pagka PCOS, 6 months pa yan. No, kung hindi ka pa nagbubuntis, huwag patingin ka na. Kasi kailangan mong tulungan para mag-ovulate ka at also to lessen your risk of miscarriages during the pregnancy. So, early detection, early treatment, and as mentioned by Ina, kailangan lifelong management to prevent yung complications ng PCOS.
Okay, well said. So, to our patients, it pays to take charge of your health. Maraming salamat po sa ating mga experts. Thank you.
Sa bawat yugto ng buhay ng isang babae, may kwento at mga kaalamang dapat pakinggan at maunawaan. POGScast. Let's talk, Pinay.